Welcome to Minute Mayor Exclusive. This is Zain. Today we have a very special show on a medical topic. Today the guest of our show is a medical doctor, also a clinical professor in his field, an eye doctor, an eye specialist, Professor Dr. Muhammad Moin. He's joining us from Lahore. Welcome to our show, Doctor. This is Zain Khan. It's such a pleasure having you.
The pleasure is the same over here, Zain. Thank you very much for the kind invitation. And I was looking forward to the interview with you.
I want to get to the first question. Please tell our viewers a little bit about yourself and about your specialization as an eye specialist.
Thank you very much. I'm an ophthalmologist by profession or an eye specialist. I've done fellowship from the Royal College of Surgeons in Edinburgh and London. And I also have done a subspecialty fellowship in vitreoretina and a degree in medical education. Currently, I am the principal working at College of Ophthalmology and Allied Vision Sciences at King Edward Medical University, where I am also the chairman of the Department of Ophthalmology.
Let's get into eye diseases. What are the most common eye diseases that you encounter in your practice?
Then there are many diseases which we face, but there are some diseases which will cause reduction in vision. So your eyesight is the main problem patients come up with, and they are the leading cause of decrease in vision is refractive errors, glasses. So the people who want to wear glasses, they are the leading population who come to us and visit us, and we're seen by ophthalmologists and by optometrists as well. The second most common, if you take the older age groups, that is cataract. Cataract is a disease in which you would get reduction in vision in older age, and that is a reversible cause of blindness. The third most important is glaucoma, which is an irreversible cause of blindness, which we get. It is hereditary disease, which we'll discuss in detail later on. Then we come on other diseases which are sort of come on, and some people they're more, some people they are less. Some people are more prone to allergies. Some people can get trauma. Some people can get infections of the front of the eye, the conjunctiva. Some people can get inflammation of the eye. So there are a range of diseases which you get, but the main problem people come is decrease in vision. And number two is they'll complain of redness of the eye, watering of the eye, photophobia, or they feel that when they go out in the sun, it hurts them. And that's how they talk. The eye talks to you that I'm not well and you need to do something about me.
Can you differentiate between age-related macular degeneration and cataracts? Are there any risk factors for the each?
Yes, they both are diseases of age, old age, and macular disease is something which would happen at the back of the eye. If you take the back of the part of the eye where your retina is and where the images form, if that is damaged with age, that would be macular degeneration. And usually that is because of certain stresses which happen at the place where the image is being formed. While cataract is something which will be present in the front part of the eye where you've got your normal lens. The lens is something which will focus light for you at the back of the retina. And with age, that becomes white. Initially, it changes different colors from green to yellow, but if it becomes mature or it ripens up, it becomes white in color. So there are two different things. Macular degeneration is something present at the back. Cataract is something present in the front. And cataract is most common cause is age in both the diseases. But in cataract, after age, the second most important cause in our population is diabetes. Diabetes causes changes in the proteins which are present in your lens, and that causes cataract. And then there are people who have kidney problems, or they've had transplants, or they're asthmatic. They use steroids. Steroids are something which can cause cataract formation, which can have early cataract formation. Then there are people who might have a genetic predisposition to cataract, and then there are people who have metabolic deficiencies. Having low calcium can actually cause a cataract as well. While if you go onto the back part of the eye, then you'll be dealing with an age-related macular degeneration, for which age is the most common cause, but there are certain hereditary diseases like angioid streaks that can also cause macular degeneration. Then high myopia that actually causes similar changes which happen in macular degeneration. And macular degeneration will cause distortion in vision. It will make things crooked. It'll make them fuzzy. You won't be able to see the face of somebody who's in front of you, while a cataract will actually cause something to be blurred. It'll be something like you're looking through a dirty glass. That would be something like a cataract. But in early stages, especially when the people are driving, and if you're driving cars at night, you can get a cataract which will cause glare because light is scattered when it comes through that area in the eye. And that is an important cause of the visual problem which you get with cataract in these patients.
You've just mentioned that steroid use could also form a cataract. We've seen after the COVID-19 pandemic, a lot of people have been taking steroids for their flu-related diseases, for their viral infections. So my question is, as a doctor, how often would a patient need to use steroids to actually get a cataract formed so our viewers can know not to use so much steroid use?
Well, it does not happen very quickly. It'll be a few months before it starts to happen. And obviously, patients with COVID and other diseases with steroids, they usually take them for a shorter period of time. It is, as I mentioned, people who are usually asthmatic, who are on chronic use of steroids, or people who are on transplants. They usually need to use steroids on long term. They also get sort of their immune suppression as well, but they also develop cataracts as well.
Glaucoma is another eye disease often mentioned. How does glaucoma affect vision, and what are some early warning signs that some of us might experience?
Zain, glaucoma is slightly different from cataract. Glaucoma is something which will cause peripheral loss of vision. So if I make a tube in front of me with my hand, and if I try to look through that tube, that tells me that the side vision is gone. So we said macular degeneration causes a central scotoma or central loss of vision. This will cause our side vision to sort of shrink. And this is also called a silent thief of vision. It causes an irreversible loss of vision and blindness. It is a major cause of irreversible blindness around the world. And this is something in which you would get damage to the back part of the eye. The optic nerve is the part which takes the signals back to the brain. They are actually damaged. And the correctable factor, or the thing which is most likely responsible for this, is intraocular pressure. And that is something like, if you compare it like broadly, if you said a car tire has got a pressure, and if you inflate it too much, it's going to cause problems, and if it's too less, then it similarly causes problem. Similarly, the eye needs to have its shape, and for that shape, you need a pressure which is in a range, and if you go beyond the range, it is going to press on the nerve, and it is going to cause a permanent loss of those nerve fibers, and that starts off silently without telling you that that's happening. That's actually the most common type of glaucoma. There's another type of glaucoma as well, which is called as acute congestive glaucoma. That actually comes with a bang. You see, you will get a red eye. You won't be able to see anything. There's going to be a lot of watering and pain in your eye, and your vision just fades away very quickly in that. And you might be vomiting all night with that. So you need to see a doctor pretty quickly with that, because your pupil gets stuck and your iris gets stuck in the angle, and that makes the pressure go really high in a very short period of time. And that is something with people come, but that gets treated. Sometimes it can become complicated, but most of the time, if they come early, it is treatable. And similarly for glaucoma, the other type, most commonly glaucoma is something which would be seen in people who would be 40 years or more. So what happens is, with age, the small pores which are present inside the eye, which drain the fluid in the eye, which is formed, they get thin, they get narrow actually. So that causes the pressure to build up. So that is the most important cause. So we ask people who are more than 40 years of age to just have their once intraocular pressure check. So that tells us they're not prone to glaucoma or they're not having glaucoma at that stage. The number second is people who have a family history of glaucoma. You might have a brother who has a glaucoma, but he hasn't told you he has glaucoma. And we might see a patient with end-stage glaucoma and we can't do anything. We feel very sorry that that happened to that guy. And similarly, steroids also have a role to play over here. Steroids, if they use like for 3 or 4 weeks, some patients who are called steroid responders, they can develop glaucoma. And then people who wear thick glasses, like -5, +5, they are also at risk for glaucoma. So that is a disease which is present around the world, and in African race is much more common. And in the Asian race, it's common with the type of glaucoma which I talked was the acute angle closure. They've got narrow angles, especially in the Oriental race. It's more common in that sense.
Professor Dr. Muhammad Moin, diabetes is a prevalent disease, especially in Pakistan. Diabetic retinopathy is a concern for people with diabetes and diabetics. Can you explain how diabetes can impact in eye health?
Thank you, Zain. Diabetic retinopathy is a disease which is of the small blood vessels in the body, and eye falls into one of them. And the two main things which happen with diabetic retinopathy in the retina. One is you get occlusion of the blood vessels get closed, and the other is leakage. It's just like if you have got a water hose and you punch some holes in it, you see a shower coming out of them. Similarly, that would happen in the blood vessels which are going through the retina, and they would start leaking. The blood comes out. Actually, the red blood cells, the hemorrhages, they can come out, but more commonly, it is the plasma or the fluid that comes out, and then the lipids come out, and they cause leakage in the retina, and the retina actually becomes thicker. It becomes wet and thicker, and the cells, unfortunately, don't function that well when they lose their thickness or the amount of water they have. The second thing which happens with them is the blood vessels, they close off. So the body says, I'm short of blood vessels, give me some more blood. So what happens? Body produces a chemical which is called vascular endothelial factor, and that is going to produce new blood vessels. So you'll get a sprout of new blood vessels like a common IV you would have coming out from the blood vessels. But those new blood vessels are leaky. Those are not the same blood vessels you get in the womb of your mother. So those are dangerous blood vessels, and they will cause, patient comes in one day, I can't see anything. Suddenly there's something black coming in front of me. There's a big cobweb, and it's sort of occluded my vision, whole of it. So that is a vitreous hemorrhage, which causes sudden and complete loss of vision. And if somebody unfortunately has got one vision, he's disabled immediately with that. So that is a very devastating complication of diabetic retinopathy. So those are the two common things which happen because of diabetic retinopathy. Otherwise, diabetes, as we discussed, can also cause the formation of early cataract. And diabetic retinopathy becomes more if somebody's got uncontrolled hypertension. If you think of that, if you've got a hose and you increase the pressure in the hose, obviously there's already leaking blood vessels. That amount of fluid that's coming out is going to get much more. And similarly, people who have got a high lipid in their blood, they're going to have more lipid leaking through the blood vessels, and they're going to have more clogging in the retina as well. So those are the two things which are very common, which happen in diabetic retinopathy. How can you avoid them? Any person who's a diabetic for more than 10 years, he is definitely going to get some sort of diabetic retinopathy. But the good thing is, like if they're insulin-dependent diabetic patients, you'll get 40% of them will get diabetic retinopathy, while a non-insulin dependent will get 20% of them. So not everybody will get a very severe or devastating diabetic retinopathy, but in order to find out who is the person who needs treatment, you need to screen them all who have got diabetic retinopathy. So the best thing is to visit your eye doctor every 3 to 6 months, according to the schedule, what he tells you, and he will come and he will either dilate your pupil or take a picture of the back of the retina, and tell you that there is no diabetic retinopathy that is threatening your vision. And obviously, if there is, if you take treatment early, that is going to preserve your vision. Because in diabetes, if you make something go down, your vision goes down, it's sometimes very hard to bring it up back to the normal level where you started off with. So it's better off that you take precautionary measures, whatever treatment doctor gives. There are 2 or 3 major treatments available, which include either injecting into the eyes a vascular endothelial factor inhibitor, or either doing laser to the retina to prevent these complications. So those are the ways how you can treat it. But I tell always the patients that diabetes is something which is going to be there in your body for your whole lifetime. So it's not going to go away. So the disease can come and go at any time. And eye doctor can only repair that damage which you have. So that repairing, you might need a few times, or you might need continuously throughout your life. So that is so important to come in and see the eye doctor regularly to keep yourself seeing so that you cannot become disabled. We've seen people going blind because of that. They used to be coming with us pretty normal, but they didn't care about the disease. And later, at the stage they came in, we said we can't do anything at this stage because it's too late.
Dr. Muhammad Moin, looking beyond these diseases, what sort of lifestyle habits, general lifestyle habits that contribute to a healthy eye?
The eye would need main things is something nutrition. So you need some fuel to come in. The eye thrives on vitamin A. You need that to make the signals in your retina. Whatever light you falls in, that's converted into electrical signal. And for that, vitamin A is needed. Vitamin A is also needed for the tear production. There's also needed for your corneal health. So that is something which is very vital for the eye. So there's some other nutrients or some other minerals which you also need. So if you take those, so mainly if you take a diet which has got green leafy vegetables, especially spinach, carrots, they're very high in vitamin A. Then if you take in meat, you can take liver, that has got high in vitamin A. So those are the diets which will help keep that vitamin in your body and supply it to your eye. That is one of the nutrition which is important. Then obviously, if you are diabetic, you need to control your diabetes because too much sugar in the blood will cause either formation of early cataract or they'll form proliferation of blood vessels in your retina. So that is the second important thing. The third is there are a lot of muscles working all the time in your eye. So you can think of your eye as an autofocus lens, which goes crazy all the time because you're making so much sudden movements all the time that the muscle contracts, relaxes all the time. So if you put too much load on that, obviously you will get eye strain, you can get headache, you can get photophobia, you can, even when you are reading or you're watching TV or working on computer, your blink rate tends to get dropped down from 60, it might drop down to 30. So what that does is makes evaporative drying of your tears and you get dry eyes. So that is something so important. So if you are using screens a lot, then something which can happen is that you will get strain in your eye, which we don't want in your eyes. And one thing more is if you do outdoor activities, you look at something which is green, that is very soothing to your eyes, and that is very good for the health of the eyes. So outdoor activities, walking, looking at the distance, that is something which helps your eyes relax and calm down and makes you work. And last of all, good sleep is something which is vital because people come with us, we've got a headache, and our eyes don't open, we can squeeze the eyes and they're all swollen in the morning. Well, it's pretty simple. If your computer needs rest, a car needs rest, why doesn't the eye need rest or the brain needs rest? So we need to work on ourselves and keep our eyes healthy and our body healthy all the time.
In the age of smartphones and also computers and laptops, we see that everybody is using screens. Now, how much eye strain does one get by using these screens, and what are the preventions, and how much screen time should an individual have?
Zan, screen time is actually very important in what your eye health is. And I think number one thing, which is a factor for the screens, is because the screens employ the maximum part of your eye resolution, the highest resolution they try to use. So if you have a very small font on your phone or your laptop, that puts stress on your eyes. Obviously, you can see that, but if you want to continuously seeing that for the whole day, then it produces a lot of stress. And the important thing is, if you're less than 10 years of age, the body, if you continuously see a screen, the body thinks probably that is the normal distance which it should develop at. So body adjusts itself and the size of the eyeball gets adjusted. So in a manner that it produces a minus correction for your eyes. So you need glasses. So we've seen people who recite the Holy Quran or who sort of do hifz, they tend to get more glasses which are minus numbered because they're all the time looking at near. Similarly, in the Asian countries, in Singapore, they found that the amount of myopia, the minus number, has remarkably increased because of screen time and because children are using the screens. The next thing is the brightness of the screen, because the brightness and the filter you have on the screen, that does have an impact on the glare you get, how comfortable your eye is, because if you've got too much light, you can see that small pupil you have that continuously becomes big and small. If you keep it all the time constricted because of bright light, you will tend to get a headache, and that is not very good for your eyes as such. And a third thing, which we already mentioned, was a computer user syndrome, that you tend to get dry eyes because you blink less, you're sitting in front of a TV, or you're sitting in front of a fan or an air conditioner, and that tends to produce that air that comes in your eyes, and that causes dryness of your cornea. So those are the major thing which happens because of the screen. But the screen also produces some other additive effects, which include an addiction to the screen, an addiction for children to just continuously play a game on the screen. Then there's a lack of sleep associated with it. You get headache with it. And there are other side effects which you get because of that. So it's a multifactorial things, but eyes are something which do get affected. But obviously, it does not 100% cause a lot of harm, because we use screens a lot as well. But a moderation is very important. And I think for this, when the 20-20-20 rule is important, every 20 minutes, you should look at something which is 20 meters, 20 feet away. And then you need to look at this for 20 seconds at that time.
You just mentioned dry eyes. I sometimes get dry eyes. A lot of my friends get dry eyes. What are the preventions? And is this actually a disease?
Dry eyes can be a disease, but the one we get is probably not that severe a disease. Dry eye has got many grades, starting from mild to very severe form of dry eyes. The type of dry eyes we get is because our blink rate is less, and we are sitting on artificial environment in which you've got screens, either intense light coming in, that produces the dryness which we have. But the other real type of dryness would be in which the tears being produced, they are reduced. And that happens in people who've got arthritis. Somebody who've got rheumatoid arthritis, their tear glands dry up, and that actually leads to very severe dry eyes, and that can cause actually the melting of the cornea, or you can get loss of vision because of the dry eyes. Now, one thing is very important. If you just remember, if there's raining and you're sitting in a car and the wipers are moving, and sometimes there's a dry spot on your windscreen, how does it feel? You don't see things clearly because of that. So similarly, the things that happens, the eyelids are like wipers, and they're sort of constantly sort of distributing those tears on the surface of the cornea. And somehow, if that distribution of tears does not happen appropriately, then our vision gets blurred. It's just not the feeling that I've got sand in my eyes. You feel something there. It's sometimes might be itching. It is more of a sign of allergy, but it's more of grittiness, or you feel that there's something moving there. But those are the things which dry eyes can produce. And the dry eyes which we get, usually that can be treated with lubricants, and that can be not very frequent. But people who get really severe dry eyes, we need to do certain procedures for them. We might need to actually plug the tear ducts so that we can retain the tears you have in your eye, similarly to making a dam for a river, so that you can keep more tears and keep your eyes healthy and keep them lubricated. And if it becomes too dry, then you can actually get a formation of a corneal ulcer. You can get an ulcer which can produce a perforation in the eye and can lead to a loss of your eyesight as well.
With eye disease progressing and so many eye diseases coming into existence, how important is it for patients and normal people to actually see an eye doctor and get themselves checked?
As we've discussed, there are a lot of diseases in which the patients definitely need an eye exam. But if we start off from a child, then I think the first eye exam we need is at the age of 5 or when we're going to school. That is so important, because if we can pick up any error of refraction or the number for glasses of a child, it is going to help him throughout his life. Because sometimes children go to school, they actually get mistreated by the teachers, by the parents, because they think they're just faking, that they cannot see, or they're just trying just not to study. Actually, what they want, what the problem is, because they need glasses. So that is very important at that level. And the next, probably the same are going to an above level, is 10 years, just to recheck if we miss somebody with a number for glasses. And as we move on, if at any stage, 20, 30, if you feel that there's any problem in your eyesight, I think one most important part is you should always close your one eye and see if you can see with both eyes or not. Because there's a disease which is called lazy eye that can happen. Sometimes if one eye is not completely developed, or there's a number in that eye for glasses, and which we do not wear them at an earlier age. And for that, that's something which gets not picked up, and we get a lot of problems because of that. And as we go older, about 40, that's the time when other diseases start to crop up, especially glaucoma is one thing. And then the other thing is presbyopia. Presbyopia is a condition in which you can see everybody when they're above 40, they can't read when they're in a restaurant and in the evening, because their near points tries to go away because their focusing power decreases. And that continues in vision. So as you grow older and you go up to 50 or 60, then cataract is the main thing, which is going to an eye doctor, and it's very important to see him. Obviously, in between, if patients get itching, watering, or any pain, redness, or any trauma, they obviously need to see an eye doctor immediately. And contact lens users, if they have any redness or pain, they should discontinue the contact immediately and see their doctor immediately, because they can get an ulcer in the eye, which can lead to a complete loss of vision. It is so important. It looks trivial, but if it's left untreated and you come late, it's very difficult to handle that bacteria which is causing that infection in a corneal ulcer.
Sir, last 2 minutes, last question. I want to ask for the viewers who are actually concerned about their eye health, you being such a senior eye surgeon, eye specialist, a medical doctor, what sort of routine would you like to give our viewers that would contribute to their eye health?
I think the best thing is get yourself a good night's sleep every day. Wake up and you can sort of wash your face and make sure that no dirty water goes in your eyes. And then if you have any glasses, do wear them. And breakfast, do eat something which is healthy for your eyes. I didn't mention fish or omega-3 fatty acids. They're very important. to help you reduce dry eyes as well. And as you go out in the day, I think sunglasses is something which have a lot of role to play. They protect. You need UV filter to prevent you from age-related macular degeneration. And they also help you in reduction of a headache, because sometimes people are just so photophobic because of light, because they just eyes are sensitive. And then if there's any problem in your eye, sometimes people have got dandruff in their eyelashes, you need to give them lid scrubs and wash them and keep your eyes healthy. Don't rub your eyes all the time. Rubbing the eyes can cause irritation, or there's certain diseases which can develop because of too much rubbing in your eye. And if you think you're squeezing your eyes to look for something, that means you need glasses. If you're going too near to a TV screen to see things, means you need glasses. And if you cannot see at work and you're making mistakes, don't sort of trap yourself into something bad. Get glasses for reading so that you can perform better and you can perform adequately. And for children and mothers, if a child needs glasses, please make them wear glasses. Glasses are the best medicine. They are even better than any medicine you can give, because they are the thing which is going to make their connections in the brain to make them see for whole of their life. We can get rid of glasses at 20 years of age if your eyesight is stable. We've got surgery which can help you with that, but you need to bear with us during that time so that you can develop ultimate good vision. And we want everybody to have good vision and not unnecessarily lose their vision. And if you're working in an environment in which you are exposed to trauma, such as industrial workers, please do wear your safety goggles all the time so that you do not get any injury, because an injury to an eye can be catastrophic, and we most of the time cannot recover all of the vision you've lost. Thank you.
Thanks so much, Professor Dr. Muhammad Moin, for being on Minute Mirror Exclusive. It was such a pleasure having you.
Thank you, Zain. It was indeed a pleasure as well for me. It's very good to talk to you, and you're doing a great job. Thank you.
Thank you. This is Professor Dr. Muhammad Moin, a senior professor and also a prominent eye specialist, an eye doctor in Pakistan. We were talking about common eye diseases, their prevention, and also treatment. Until the next episode of Minute Mirror Exclusive, this is Zain Khan. Take care. Goodbye.